Welcome to Financial Insider Weekly. I'm your host, Michael Gray, CPA. My guest today is Don Pollard. Don is a chartered life underwriter and chartered financial consultant. He is an independent insurance broker located in San Jose, California. His company is called Advanced Professionals. His practice offers individual insurance, Medicare, employee benefits, and executive life and disability insurance planning. Don has worked in the insurance industry since 1973, only yesterday. That's 40 years, isn't it, Don?
That's close, yeah.
Isn't it? He's managed insurance agencies and trained agents. Don is a past president of the Silicon Valley chapter of the National Association of Insurance and Financial Advisors, and currently serves as a national committee person. Because healthcare insurance is such a critical area, we devoted some consecutive interviews related to healthcare reform, but today, actually, we're talking about the implementation of healthcare reform. What we've seen is, healthcare reform has been rolling out. It is effective, basically supposed to be in place the 1st of 2014, and we've had some signups we're going to be talking about online and so forth. So anyway, you can find some of our past interviews at financialinsiderweekly.com, but I think you'll want to mostly focus on today. So anyway, as we do this, this implementation is happening from state to state. And so things are going to vary a little bit. Be aware of that because some of our viewers are from out of state. We're focusing on the Covered California program, which is what we're doing in California. And get help. Help is available. We'll be talking about that. So you need to talk to someone who's familiar with your state laws. Don, thanks for joining me today.
Oh, you're welcome, Mike. Great to be here.
Okay. All right. Well, healthcare reform is really here now. We're starting to really feel it. So maybe you can talk a little bit about the current status of the Covered California enrollment effort.
Well, I'd like to. You're right. The day of reckoning is here. Yeah. And fortunately for us in California, we are not experiencing the same type and magnitude of problems that the federal websites are experiencing. We are not, I don't think, up and running to exactly where we want to be yet. But they're doing pretty good, and it still takes a little long to do some things during certain times of the day. But basically, they're very excited. The exchange, the people that run the exchange, very excited. They received roughly 650,000 hits on their first day when the website was open back there in October, and so they were able to get through that. They've received about 2.4 million hits since then.
Now today is December 17th, folks, just to let you know where we are, so you'll be seeing this sometime afterwards.
Right. They report that their call center had received over 250,000 calls and responded to those. So that's good. And so far, since the beginning, they report 2 days ago that they've enrolled 370,000 people have applied for insurance. Now, as you know, application and the ultimate result is a sifting and winnowing type process. So, and especially in this environment we have today, because the website actually goes out and electronically checks the information and verifies the information that people put in. So sometimes that takes quite a while. At the end of the first of the period since October, we've had 60,000 people that have actually enrolled in the plan, and they report that currently they sign up about 2,400 people every day, and they estimate there'll be about 2.3 million in the exchange by 2017. It is sometimes frustrating when you go on, because the times it takes to respond to your requests are long. And I've found my secret is to go on late at night.
Oh, okay.
And so if I'm uploading verification documents or something like that, it seems to be more friendly late at night. So
So like you're in there at 11 o'clock at night?
no, more like 2. Yeah.
2 in the morning?
2 in the morning.
Oh my God. Okay. But if you can speed things up, because when you have a lot of people that are using online applications, quite often it can slow things down. So anyway, so we've got your secret here, folks. So now things are going to start backing up at 2 o'clock in the morning.
Yeah, there you go.
Okay. So anyway, well, I mean, really, they've got a huge task here.
Monumental task, yeah.
And that's part of the frustration, because we're talking about, we have millions of people in our country that are impacted, and some of them have received notices that their insurance is not going to be continued and so forth. Maybe you can talk for a few minutes about some of the problems that people have been encountering.
Well, you mentioned one of the big snafus, I think, was this idea that in California specifically, or actually all across the country, but in California, they've decided to stay the course and cancel all policies that do not contain the essential benefits, so they don't qualify as essential coverage. So that's about 1 million policies in California out of 1.8 million individual policies that we had.
So that's more than half.
More than half have been canceled as of 12/31 now. And when the president came on a month ago or 3 weeks ago and said that he was going to change that, our Covered California group decided not to go along with that request. So our plans are basically all going to be terminating at that point. Now, per company, Blue Shield has allowed an extension on their plans. But the thinking here is several-fold. Number one is lots of those people who received termination notices are healthy people, and if they were allowed to continue their existing insurance, the fear was that they wouldn't come and embrace the exchange. And as we all know, we need healthy people, we need young people in the exchange in order to make it work, because we're taking in a lot of older people, a lot of people that haven't been able to have insurance in the past because of pre-existing conditions, and so we have to have what's called good premium along with the people that are going to be making the claims against it. Now, the contract with Covered California requires that the carrier cancel their policies on December 31st. So this is not a carrier type of idea. It's Covered California that's driving that. The other thing one of the other problems that we have is that the physician lookup tool, which allows a person to go on and look up for the various plans to see if their physician is in the network, and that is not working correctly yet. And this is especially problematic because the new plans that have been developed, ACA compliant plans, most of them are using different types of networks. So what we in the business call skinny networks. In other words, they're not the full PPO network that you might be used to. There's some subset of that. And so it becomes critical for people to have the opportunity to go in and check to make sure that their doctor is in fact participating in the plan, because as we all know from all insurance in the last 25 years, if you don't go to a participating provider, you're very disappointed, even angry at the outcome.
Now, let's back up for just a moment.
Sure.
So the president has said that we're supposed to have an extension out to March 31st for this new coverage. Is that happening in California?
The extension is, yeah, the extension is still there, and that relates to the penalty on the tax return.
Oh, okay.
Okay, so what I was addressing is the plan design that must be offered and purchased. So yes, I mean, I guess you could let your plan go at the end of December and then not pick up another one until March 15th, and you'd still wouldn't be subject to the tax or the penalty on your income tax return.
Okay,
so that's what that.
But we still, basically, if we want to be sure that we're covered, then we need to have our coverage in place in California with our new policies, really, by January 1st.
That's right. For individual plans, specifically, individual plans are the ones that are affected the most. Individual, again, all the existing plans will be non-compliant January 1st because they don't meet the essential benefit test. So what people should be doing currently is you should be looking to shop around to find a plan that's appropriate for you price-wise and benefit-wise. And that can be done either through the exchange or through the individual policies with the help of either a paid administrator or a broker like myself. So you should be doing that for sure. For people who don't do that, or they get confused, or they don't want to, your individual plan will be mapped by the insurance company or the HMO to a plan that is compliant January 1st. So you either take an active participation in it, or if you want to be passive, you can just let them decide where you go for next year.
So I think what we're saying, I think what you just said is, if you have a policy in place already as an individual health policy. Now, when we say individual as opposed to a company-provided plan, okay?
Correct, yeah.
Or if you work for the government, a government-provided plan. Then if they are going to suggest to you a replacement policy for you if you don't otherwise shop and find something for yourself.
That's right. Yeah, so they're going to say, well, okay, you had XYZ plan. This is a plan that's close, and this is the plan that we're going to send you over to if you don't tell us what else to do. Okay. So you could either cancel it, or you could make an active decision to purchase a different plan. Or but again, I think the whole idea of the ability to utilize the exchange, the shop in the exchange, is the idea that you do shop. Go take a look around, see what's there.
Well, I'm thinking of, we've got 2 million people, more than 2 million people, that need to get signed up in these programs. Because we had 1.8 million that were already insured, and then we have to add hundreds of thousands of people that weren't previously insured.
Right, yeah.
And so, realistically speaking, we only have a fraction of those already signed up. That we have to find some way to get these other people set up by January 1st. And today is December 17th. How the heck is it going to happen?
Well, exactly. And actually the cutoff date for the exchange policies is currently the 23rd. So that extension has been given. So people, instead of the 15th, which was the former drop-dead date, if you will, and now it's the 23rd, so people need to go on and make some action there. Otherwise, you miss the opportunity, because your plan, the normal time frame for them to issue a plan once you've applied, they require 15 days of time, 15 days to do that.
So they're already crunching it.
So they're already cutting it back in order to, like you say, to try to facilitate the people that are going to need to get in. But that's another key on your dates that you want to think about as well, because March 31st is the deadline for signing up to have it effective April 1st, but that's really March 15th, because they need 15 days. You have to sign up 15 days before your effective date.
Right. So even though we've had this so-called extension out to March 31st, really, you need to be, and this is probably going to be broadcast early in January, or what we're talking about right now. So anyway, so anybody that's not done, if you will, you need to be done really by March 15th to avoid potential penalties applying related to this. And then there's the issue, again, of just having coverage. But I think that most people that have existing coverage, one way or the other, they're going to get something in place by the first of the year. There may be an issue related to whether they have a second deductible if they change to a different plan at a later time.
Well, remember, what we have now,
Okay.
currently, is what's called an open enrollment period.
Yes.
So you have that period, and it runs through March 31st, okay, this year, but that's going to change next year, and it's going to coincide with the Medicare open enrollment period, which ends on December 7th. There is no changing once you decide on a plan during the year unless you have extenuating circumstances, life events, if you will. For example, you have a child born to you, okay, then you can change. You get divorced, you can change. You move to a different state, obviously you can change. So, but there are limitations to that, so you can't just freely exchange during the year like you can now, even though, you can't do that now either if you've got any kind of pre-existing condition going on for you.
Right. Okay, well, we've got probably about 13 minutes left.
Okay.
We've got a lot to cover. So anyway, so you talked about some of these important dates. So maybe you can talk a little bit about, who are some of the companies that are participating in the exchanges and so forth? Well,
we have the major companies that you would think of. We have Anthem, Blue Cross, Blue Shield of California, Health Net, Kaiser, of course, and then we have some regional plans, Sharp and Western Health. They operate here in Northern California. The plans, the companies, the carriers that are conspicuously absent from participation in the exchange are Aetna, Cigna, and United Health. So they're not participating. Now, before anybody panics, they really only have or serve 7% of the individual marketplace today. So they weren't a big player. I think that's more than likely. They probably feel that they don't have a big enough book of business to where they can make decisions that they would be required to make in order to expand what the policies cover and then to take in new people that, basically with no underwriting, which is what's going to happen now. Everybody.
Does that mean that these people are no longer going to be offering plans in California? So Aetna, Cigna, United Health, are those plans just going away?
They're no longer going to offer individual plans.
Okay.
Yeah.
Okay. I don't think we have time for essential benefits, but
if I could mention just a couple of things about the essential benefits that might have a tendency to raise premiums. So we hear a lot of talk about the premiums going up.
Okay, yeah.
And they are to some people. They go down for others, and we can talk about that a little bit if it's required. But the inclusion of maternity on all policies now, so that we take advantage of the idea of insurance, where everybody pays a little in order that the few or the many that need it get a benefit. So before, in the current marketplace, maternity was cut out of many policies, which then reduced the price. So that's now required to be included in. In the pediatric arrangement, we have now the addition and requirement of a dental and vision benefit, which wasn't there before, so it was only medical insurance, but the pediatric care is pretty much the same. And then you have the expansion of mental health and substance abuse coverage, which basically in policies before was always limited severely to what was totally covered, and now it's part of the essential package, and so those limitations have been released, and so that's what's going to cause that to go up, the pricing to go up if it does.
Okay. So thanks for pointing out those few things. But why don't you talk a little bit about the levels of coverage and what they mean and what have you?
Yeah, the levels of coverage have not really changed from the beginning. So they are as announced originally. They're called the metal plans. And they're basically describe the percentage of a person's estimated healthcare expenses that will be covered and paid for by the plan. So we start on the low end with the bronze plan, which is a policy that's designed to reimburse you, the participant, roughly 60% of your costs of medical care in a year, and those are averaged out costs. So the bronze is the lowest at 60. Then we have the silver plan, which is designed to cover 70%, and the gold at 80, and then the platinum, the best, is a 90% plan. Now let me hurry up to say that those are general guidelines of coverage. So what the Act allows the insurance carriers to do is to design the internal provisions of the plan, how the benefits are actually paid within the plan in different ways. So for example, you'll see plans that are designed with a copay, which we're pretty familiar with that these days. So there'll be some set of plans that have a copay for office visits and that kind of thing. And then we'll have other plans that are based just on a percentage of reimbursement. The key to remember is that all of these plans have the same basic overall requirement, that they meet 70% of your expenses, or 60%, or whatever the plan is. But internally it can be done differently. So if you're a person who'd rather have a copay idea, you can get a plan like that. If you're a person that would say, well, no, I'll just pay a percentage when I go, then you can get a plan that works like that as well.
So when we say a copay, we're saying like $40 for an office?
$40, yeah, or whatever, $25.
Yeah. Okay.
Yeah.
Okay. So how can you get help in finding your way with all this stuff? This is very, for most of us, health insurance, really, it's like over our head.
Yeah, and I have to say that I don't think that the website is not that easy to operate. I mean, it's not that hard, but it's also not easy, and then you run into places where you do need someone who's done it more than once. Of course, they want you to go to the website, coveredcalifornia.org, and it is extensive, and in some ways it's slow. And for example, it was in repair from midnight last night till about noon today. So they take it down periodically to try to enhance it and fix it up. So you have that. And you also can get help from licensed insurance agents like myself. There's roughly 3,200 of us that are certified now to operate within the exchange to help people get those policies that can be offered there. And there are 19,000 more that have applied for it, but they're somewhere in the training process before they get finished, and that's been a drawback of the plan, is it's been very hard to certify people through because of the system that they designed to do that. There are also assisters and enrollment counselors. You probably heard of these folks. They're generally through nonprofits and hospitals that have also sat for the training that must be done in order to help people through. And there's about 1,000 of those that have been certified so far, and there's about 4,000 that are still in the process. So far and away, the insurance agent is going to be the bigger pool of people. Now, they do have a system where when an individual like yourself were to go on and apply for coverage, then you can then right through their system appoint me as your agent. So you click on a thing and it brings up all the agents in your zip code that you've chosen, and then you can select of the ones that are certified. These people can help you. And I'll give you an idea. A fellow in my neighborhood last night called me, and he said, "Hi, I got your name off of the website on the exchange. I've submitted all my stuff." So he'd done all of his stuff on his own, but he couldn't get it. He couldn't figure it out. He couldn't figure out why they wanted this and that. And so I went over to his house and spent an hour with him, getting all straightened away. And I was there in an hour and a half. Now that's not going to happen for everybody, but it did happen for this fellow. So he, I think, is satisfied with that service. He needed help. He requested it. He got my phone number. He called me. I went over and saw him.
Okay. So Don, believe it or not, we're almost out of time. We've probably got
Cool.
about 2.5 minutes. So maybe, though, you can talk a little bit about the help that people can get now that are low income and so forth.
Okay, sure. The tax credits that are available come in basically two sizes. One is a premium, an actual tax credit against premium payment. So that's the monthly payment that you pay. And depending upon your income level, you could also qualify for a cost-sharing reduction. So, for example, if you had a plan that paid 25% to a maximum out-of-pocket of $6,500, and based on your income, you qualified for a reduction in that, that maximum out-of-pocket might be reduced to $2,000. So you'd only be required to pay, 25% until you've paid $2,000. So two kinds of subsidies. They have a system, and this is one of the reasons that it does take a long time to verify, is that when you go on, you initially will give them your income, tell them how many people in your family, and then the system will go out and search out your Social Security records, they'll search out your income tax records, and it comes back and says, okay, you're conditionally certified or you're not certified, or you need to provide us with more information in order for us to make a decision. So all of that is automated. So once it gets all resolved, it should work pretty well. So your basic levels now, if a person is eligible for Medi-Cal, which for an individual is roughly $15,500 of income in a year, those people will qualify for no-cost insurance. Then you have varying levels of subsidy up to 400% of the federal poverty level, which for an individual is roughly $40,000 in annual income, and for a family of four, it's roughly $94,000 of income. So you can see you can have quite a substantial income and still qualify for some type of reduction. Now, as you get closer to the top end, that reduction lowers down, reduces, but still designed to help a lot of people.
Okay. Don, we're really all out of time. I really want to thank you for joining me.
My pleasure.
Updating us a little bit about this. Obviously, folks, this is a big topic, and so we've hit some highlights. I hope that you're having good luck finding some help out there. There's been a big enrollment for Medi-Cal, as I understand, related to this. So people who haven't had coverage in the past can now. We'll see you next time on Financial Insider Weekly.